Carpal tunnel syndrome. The carpal tunnel is a narrow passageway in the wrist, about an inch wide. The floor and sides of the tunnel are formed by small wrist bones called carpal bones. Because these boundaries are very rigid, the carpal tunnel has little capacity to stretch or increase in size. The roof of the tunnel is a strong band of connective tissue called the transverse carpal ligament. The carpal tunnel houses the flexor tendons that allow you to bend your fingers, and the median nerve that provides sensation to most of your fingers and hand. It also controls the muscles around the base of the thumb. Tissues surrounding the flexor tendons are called synovium. These tissues lubricates the tendons, making it easier to move your fingers. Carpal tunnel syndrome occurs when the tunnel becomes narrowed or when the synovium swell, putting pressure on the median nerve. Causes: heredity. The carpal tunnel may be smaller in some people, or there may be anatomic differences that change the amount of space for the nerve. Carpal tunnel syndrome is generally more common in women. This may be because the carpal tunnel area is relatively smaller in women than in men. A wrist fracture or dislocation, or arthritis that deforms the small bones in the wrist can alter the space within the carpal tunnel and put pressure on the median nerve. Obesity is a risk factor for carpal tunnel syndrome. Fluid retention may increase the pressure within your carpal tunnel, irritating the median nerve. This is common during pregnancy. Carpal tunnel syndrome associated with pregnancy generally gets better on its own after pregnancy. Birth control pills or hormone pills are risk factors as they alter the levels of hormone in the body, resulting in swelling in carpal tunnel and nerve compression. Some chronic illnesses, such as diabetes, increase your risk of nerve damage, including damage to your median nerve. Certain conditions, such as thyroid disorders, may increase your chances of carpal tunnel syndrome. Working with vibrating tools or on an assembly line that requires prolonged or repetitive flexing of the wrist may create harmful pressure on the median nerve. Many times there is no single cause of carpal tunnel syndrome. It may be that a combination of risk factors contributes to the development of the condition. Symptoms: you may notice numbness, tingling, burning, and pain in your fingers or hand. Usually the thumb and index, middle or ring fingers are affected, but not your little finger. You might feel a sensation like an electric shock in these fingers. This sensation may travel from your wrist up your arm. The numb feeling may become constant over time. You may experience weakness in your hand and drop objects. This may be due to the numbness in your hand or weakness of the thumb's pinching muscles, which are also controlled by the median nerve. This may make it difficult to perform fine movements such as buttoning your clothes. These symptoms may wake you from sleep. In most cases, the symptoms of carpal tunnel syndrome begin gradually without a specific injury. You find that your symptoms come and go at first. As the condition worsens, symptoms may occur more frequently or may persist for longer periods of time. Symptoms often occur when holding something for a prolonged period of time with the wrist bent forward or backward, such as when using a phone, driving, or reading a book. Diagnosis: the diagnosis is usually clinical. Your doctor will ask you questions and review the pattern of your symptoms. He will conduct a physical examination. He will test the feeling in your fingers and the strength of the muscles in your hand. Bending the wrist at 90 degrees for 60 seconds, also called Phelan's test, or tapping lightly over the median nerve at volar aspect of the wrist, Tinel's sign, can trigger symptoms in many people with carpal tunnel syndrome. X-rays are not helpful in making a diagnosis. However, some doctors recommend an X-ray of the affected wrist to exclude other causes of wrist pain, such as arthritis or a fracture. Nerve conduction study, NCV, can be ordered to identify any potential areas of blockage or compression. In other cases, a doctor might conduct an electromyography, EMG, to identify damage to the muscles controlled by the median nerve. Ultrasound helps check the median nerve for signs of possible compression. Blood tests may be ordered if there are other signs suggesting comorbidities, such as diabetes or hypothyroidism. Treatment. In the early stages, simple things that you can do for yourself may make the problem go away. For example, take more frequent breaks to rest your hands. Avoid activities that make symptoms worse. Apply cold packs to reduce swelling. Try to lose weight if you are overweight or obese. Your hand and wrist may be immobilized with a splint or wrist brace for 4 to 6 weeks. These braces are often worn at night, although they may also be needed during the day. Non-steroidal anti-inflammatory drugs may help relieve pain from carpal tunnel syndrome in the short term. You may be referred to physiotherapy to be taught strengthening and stretching exercises. Your doctor may inject your carpal tunnel with a corticosteroid such as cortisone to relieve pain. Corticosteroids decrease inflammation and swelling, which relieves pressure on the median nerve. Sometimes an ultrasound used to guide these injections. In severe cases where non-surgical treatments have failed or muscle weakness has begun to occur, surgical intervention may be needed to correct carpal tunnel syndrome. This procedure is known as carpal tunnel release. This procedure requires a small incision in the palm of the affected hand. Through this incision, the surgeon can access the wrist and split the transverse carpal ligament, which serves as a roof at the top of the carpal tunnel under direct vision. This opens the space and relieves pressure on the median nerve. Post-surgery rehabilitation. Immediately following surgery, you will be encouraged to move your fingers to reduce swelling and prevent stiffness. You may have to wear a splint or wrist brace for about a week. You will, however, be allowed to use your hand for light activities. You will be started on a physical therapy program, where you will be instructed on special exercises to improve the movement of your hand and wrist. You should expect some pain, swelling, and stiffness after your procedure. Minor soreness in your palm may last for several weeks to several months. If your symptoms were very severe, symptoms may not go away completely after surgery. Grip and pinch strength usually return by about 2 to 3 months after surgery. If the condition of your median nerve was poor before surgery, grip and pinch strength may not improve for about 6 to 12 months.